So now it's a very great pleasure to welcome David Wilson from the World Bank. And perhaps this is the reality check, because here we are, we've got the great ideas, we've got the technology, we've got the drugs, we've got the cities. What about the money? David.
Thank you. I've been asked to talk today about innovative financing. And I'd just like to make the point that we're in a situation where HIV financing is still characterized by high donor dependence. And I'll illustrate this in high, medium, and low burden epidemics. But this graph really nicely shows that 80% of resources for HIV are still external in many high prevalence countries. And this graph shows some of the positive outliers like South Africa, Lesotho, Tanzania, but it also shows a cluster of red negative outliers. And if we look at the same data for middle income countries, you see your positive outliers, Brazil represented here, Thailand, Guatemala, but we also see some very negative outliers too. And then if we turn to low prevalence countries, we see a similar pattern, with countries like India being extremely positive and countries clustering in below the line representing high donor dependence. We also know that HIV financing is characterized by uncertainty about future financial assistance, as evidenced by flat donor funding. And this flatness is becoming even more marked when we look at disbursements as opposed to commitments. And I'd just like to make the point that health budgets are very volatile, as this World Bank chart for as many countries as we could find shows, and fluctuates wildly. But HIV treatment financing cannot be volatile. So we have to smooth out the volatility. And I'd like to highlight private out-of-pocket spending. And we know this is a major source of health spending, and we know that catastrophic out-of-pocket health spending can lead to or keep people in poverty. And this graph here shows the extent of the reliance on out-of-pocket spending in different countries, ranging from 80% in Sierra Leone, where we're also grappling with Ebola, to 50% in many other African countries. The good news is Africa's economies are growing at the fastest rate since independence. And this is illustrated in this graph here, which shows compound real growth. The more cautious news is that GDPs have been growing without commensurate investment in the social sectors, in education, health, and HIV. And I'm illustrating this here with reference to two countries, Nigeria and Cameroon. And we see that their GDP growth has not been matched by commensurate health spending. And when we look specifically at HIV, and we take two increasingly prosperous African countries, Kenya and Nigeria, we see that domestic HIV spending has increased, but it's still less than 10% of total HIV spending. And given Kenya's rapid economic growth and given Nigeria's resource wealth, this is a situation we need to note. I'd like to turn specifically to innovative financing, and there are three major definitions. I'll leave these definitions for you to briefly glance at, and then I'm going to extract the commonalities from them. But we have a World Bank definition, the Leading Group on Innovative Financing definition, and we have the High-Level Task Force definition. What they have in common is the following: mobilizing resources from outside traditional donor sources, striving for self-replenishing pools to reduce donor dependency and to promote long-term sustainability, and critically focusing on complementing, not displacing, traditional financing. So those are the key objectives of innovative financing. I'm going to look at the range of innovative financing mechanisms that have been developed with case studies. And when we turn to taxes, I'll look briefly at financial transaction taxes, resource taxes, consumption taxes, income taxes, again, financial transactions, corporate taxes, wealth taxes, and sector-specific taxes, such as trust funds. I'm also going to touch on solidarity mechanisms, investment of dormant funds, lotteries, public-to-private mechanisms, impact investment, and private sector participation. And this is a broadly representative view of the range of innovative financing options that are being tried. Let's turn first to the popular financial transactions tax, or Tobin tax, which is used in Argentina, Brazil, and Zambia. And I'd just like to highlight an Indian example. India could raise almost $400 million a year from a very small 0.0005% levy. And Gabon has actually raised $30 million for health from a 1.5 levy on remittances. But one has to note that that's not necessarily pro-poor, because those remittances may play a very important part in household wealth and welfare in Gabon. Resource taxes. Botswana is a great African example, but the Lao PDR and Papua New Guinea also impose resource taxes. And those resource taxes could be channeled towards the social sectors, including health and HIV. Consumption taxes are popular for a variety of reasons, but particularly because they can be targeted towards higher levels of consumption or undesirable forms of consumption. And luxury taxes have been applied in Vietnam and Bulgaria, in China. Mobile phone or telecommunications taxes are common and have been used initially in the Philippines, but in many African countries, including Uganda, Ghana, Gabon, Senegal, the Republic of Congo. We've seen tobacco and alcohol taxes proliferate, and we've also seen a growth in sugar drink taxes, Iran, and recently in Europe, Hungary. And we've seen the use of VAT, value-added tax, which can be tailored to be pro-poor, develop Ghana's health insurance fund and Chile's very robust fund. Let's look in particular at value-added tax, which is a broad-based consumption tax. And this is very popular, but economists do argue that it can reduce the incentive to work because it doesn't tax leisure. So very, very high consumption taxes can potentially have negative effects. And it must be acknowledged that because these are passed down the chain, VAT can increase the cost of living and in particular negatively affect low-income households, unless they're designed very carefully to mitigate this, as Ghana has tried to do. And let's look at Ghana's well-known NHIL, the National Health Insurance Levy, which is a 2.5% added to VAT and used to fund 70% of the NHIL scheme, which is a pro-poor scheme to finance healthcare and reduce health costs among low-income Ghanaians. And here's an example of the growth in revenues from 2004 to 2009. It's generated almost $750 million Ghanaian cedi, and it's considered progressive because many goods and services that are the bulwark of low-income household spending are exempt. Let's turn to excise or sin taxes, which are becoming increasingly popular. And they try to address externalities and to focus on global bads, such as tobacco, alcohol, junk food. And they're very common in developed countries. You simply have to look at the price of cigarettes or alcohol in many developed countries to understand this. But they're also growing in developing countries as their own NCD burden increases. And they can raise significant revenues in developing countries, but they are politically and logistically challenging. They're obviously resisted by the affected industries, which can be extremely powerful. Things like unhealthy food are quite hard to define in a way that's not easily circumvented. And they can be difficult for lower income countries to enforce. And it has to be acknowledged they can be regressive because many of these items are consumed particularly by low-income households. But look at Thailand for an example. Thailand taxes alcohol and tobacco, and 2% of the taxes are earmarked for the Thai Health Promotion Foundation, contributing 2.3 billion baht in 2005, or $57 million, which is spent on health promotion. And on the one hand, you could argue this tax is pro-rich, because the rich can more easily afford the taxes on alcohol and tobacco. But on the other hand, you could argue that poor people will be more responsive to its behavioral shaping influences for exactly the same reasons. So those are the factors that you weigh up. I'd like to turn to trust funds and levies, which are set up specifically for sectors or issues such as HIV. And Kenya, Tanzania, and Uganda and East Africa are in the process of establishing trust funds. Kenya is perhaps most advanced. The proposition is to allocate 0.5% to 1% of government revenues to the trust fund, to be complemented by additional sources such as airline levies, with the hope that would fill 70% of the HIV funding gap between 2010 and 2020, and 160%, in other words, more than required by 2020 to 2030. The most famous example of an HIV-specific trust fund or levy is Zimbabwe's National AIDS Trust Fund, which was a 3% payroll levy set up in 1999 to fund the National AIDS Council, which has generated $2.6 billion and is managed by the NAC and disperses money to various implementing partners. The key points about this levy is it depends crucially on the economic climate of the formal sector. And when the formal sector shrunk in Zimbabwe, revenues shrunk with it. So it's been volatile. Its efficiency is also highly linked to government revenue-raising capacities, which are variable in low-income countries. I'd like to move now to debt swaps, which I'm sure we've all heard of. But Debt to Health was a partnership that linked two countries, a creditor country which cancels a bilateral debt in exchange for the debtor country reinvesting in health through projects such as the Global Fund. And as of October 2010, 210 million of debt from debtor countries had been written off by creditor countries for health. And here are some of the more famous exchanges. There's the Australia-Indonesia TB program exchange, Germany-Côte d'Ivoire's HIV exchange, Germany and Indonesia's HIV exchange, and similar exchanges in Germany with Pakistan for HIV and Egypt for malaria. So they've been a promising source of additional revenue where we've had significant debt. I'd like to move to more frontier propositions, such as bonds. And these are tied to results and outcomes. And we have, for example, loan conversions, where a loan is given to a country to implement a program, and the loan is actually repaid, written off, if the program is successfully implemented. And this is quite close to what Meadover calls cash on development, where you pay for its successful results. We also have social development impact bonds, which are mechanisms for private investors to invest on the basis of improved health and development outcomes. Let's take a nice example of a loan conversion. Japan's JICA provided 5 billion yen, or $65 million, to Pakistan to support polio eradication. And the Gates Foundation underwrote this, saying they would repay JICA in full if the targets were met. And from JICA's point of view, the advantage was they needed to get money off their books quickly, and from the Gates Foundation's point of view, it's a performance incentive. And DFID has launched the first round of social impact bonds, focusing in particular on sleeping sickness, trypanosomiasis in Uganda, by designing a bond to purchase drugs to treat infected cattle. Social impact bonds can also be seen in Mozambique, and these can be quite complex in their structure. And here are the details of the Mozambique malaria performance bond, which tries to address the funding gap in malaria interventions. I'd like to turn to the role of the private sector. And we know that in many high-burden countries, the private sector has played a leading role in in fighting AIDS domestically and financing it globally. And Anglo-American, which was the first large company to treat AIDS in South Africa and is now a significant contributor to the Global Fund, is a very good example. We think that about an additional 0.15% of global demand could be met through private sector mainstreaming. So it's contributory rather than transformative, but it's important. I'd like to focus on corporate social responsibility, which is growing. And one of the best examples is Mauritius, which has a law mandating all registered companies to contribute 2% of their book profits to corporate social responsibility, nearly all through civil society organizations. And this has financed health programs. It's also financed HIV programs, including successful harm reduction programs for drug users. So this has been successful in the field of HIV. And Indonesia has recently passed its own CSR laws, but they are in its infancy, and they face a lot of challenges, including opposition from the business community, who argue the laws might be inimical to investment. It's also hard to regulate, as specific amounts and percentages have not yet been mandated. And the management of the funds and the governance of the program hasn't been specified. So effective CSR can be complex to establish and to manage. I'd like, in my last few minutes, to just focus on where we are with innovative financing and what the horizon looks like. And the first point to acknowledge is we've had many innovative initiatives, but we haven't seen whether any of them are sustainable. So the sustainability, the long-term dependability, the ability of innovative funding to do what it hopes to do and reduce volatility hasn't yet been demonstrated. The notion of ring-fencing or protecting or hypothecating funds in innovative financing is also contentious. Economists argue that it's administratively highly inefficient, that it deprives the government of the ability to set and guide its own priorities, and that it's sometimes unresponsive to the problem. And there's quite a nice example of the India highways tax, which is a specific, hypothecated, supposedly innovative form of funding to maintain India's roads. It hasn't worked well, as people who've worked or visited India can attest. And there are a lot of reasons for that. Often, the roads that the trucks travel on are not where the trucks are registered and the revenue accrues. So the revenue often accrues to trucks registered in areas with very little actual trucking, who have a surplus of money, which can't be flexibly applied where the highway needs are. We've also seen the government has deprioritized roads, arguing there's a road fund for it, so that's taken care of. So they no longer see it as part of their funding responsibility. So the notion of ring fencing is challenging, as economists will attest. There's the obvious challenge of what will be prioritized. And just to acknowledge that there are so many competing demands for innovative financing. Climate has an increasingly large stake, particularly if we're looking at extractive or other industries who may be contributing to climate change. Within health, it's often likely that sin taxes on tobacco and alcohol may be applied more directly to NCDs than to HIV, with whom the relationship is not as close. So we can't be sure that having innovative finances will lead to greater investment in health per se or HIV specifically. There is a real issue of displacement, and that is when we establish a ring-fenced innovative fund for a specific issue, the government simply withdraws its complementary compensatory resources. And I gave India's highways earlier as an example, where the government says, we have a fund for this, it's up to them. And there are a lot of examples of where ring fencing causes the government to withdraw from a priority. This is also the challenge we face with substitution. And as of now, I think we could say that innovative financing has some interesting potential applications, but the magnitude of its contribution to overall financing is small. Its sustainability is uncertain. And it does seem likely that the three major potential avenues for continued HIV financing in the foreseeable future will continue to be international assistance, growing domestic assistance from countries whose own economies are growing, and also integration of HIV into health pools, such as universal health coverage. And I think if there's a single thing we really want to ensure we focus on, it's integrating HIV into the universal health coverage programs that are emerging in so many places. And Thailand has done it well, Mexico has done it well, and what Thailand actually learned is it could incorporate HIV into its 3 universal health coverage schemes at much lower cost than people have predicted. So it's actually been a good investment for them. And this graph really just summarizes the same points. These are things we can do to increase government spending. It's a spider graph. And so what it shows is, ideally, we can grow our macroeconomy, which means we've baked a bigger pie, more pie to go around. We can reprioritize, move money away from low-priority interventions or low-priority facilities or low-priority geographic areas towards high-priority ones. And the yields here can still be considerable. They may be in the order of 30 to 40% if we can do it really well. And that's far from negligible. We can continue to rely on foreign aid, and what we're likely to see is international assistance moving out of middle-income countries and concentrating increasingly on low-income, high-burden countries. And Badara gave the excellent example of Malawi, which is likely to remain reliant on external financing for a long time. And we can also focus on efficiency. And this was discussed in some of the earlier presentations. So realistically, innovative financing is one part of several things that we need to do together to sustain HIV financing and impact. Thank you.
Thank you very much, David. Now we've got a couple of minutes over for questions. Would you be prepared to
Sure.
take some questions from the floor? Is there anybody has somebody already got the mic as per last time? While people are thinking, I just wondered whether you could reflect. In the UK at the moment, in the English health economy,
Yes.
we find ourselves in an interesting position with HIV where part of the pathway is financed through one part of the system, so through local government, and the other part of the system, for example, treatment and care, is financed centrally through NHS England. And so the gain share of making efficiencies in one place are not necessarily felt elsewhere, and whether you've got any reflections on places where that's working, any examples of how we might, particularly in England, start to knit that together.
That's a great point. That's one of the challenges of decentralization, as you know better than me. There aren't very many good examples or easy answers for that. Yeah.
Okay, well, we shall see what we can innovate and what we
Yes.
might be able to do here. Anybody else with a question? No? Surely money usually garners huge numbers of questions. Well, in that case, may I suggest then that we move on to Alan Whiteside, who is also going to talk about money.